as you know, the last lecture that I'm going to give in 2 weeks' time, I think, is going to be about Jewish sex. So just to compensate and to make sure that you don't have too much fun here, today we're going to talk about death. What a beautiful topic, right? Luckily enough, no homework for anyone. However, talking about this issue, I didn't plan it about 4 months ago when Michelle came up with the idea of Ora Torah, but apparently euthanasia is a hot potato now in New Zealand, in Wellington, in the newspapers, and one of the people who was interviewed about it is our dear Jonathan Adler, who's a doctor and a member at Temple Sinai, and a proud father of four.
Could you talk louder, please?
We have a dog. Well, you know, it's always good to wait to be a doggy sitter or to have grand dogs later on in life. And as you know, euthanasia is something that first I have problems to say in English because I don't quite understand the concept. In Hebrew, it's much easier and much more controversial. We call it hamatat chesed, graceful killing. Okay? Or you can translate it in different ways, but it does mention the fact mercy killing. Okay, hamatat chesed. But it does mention that it's an active act to take life. And then comes the reason, chesed, of loving kindness, or merciful, or graceful, or you name it. But it describes an active act. And most of the debate around this issue, whether if it's in the legal system in the States, in Europe, in the continental legal system, in Israel, which is a combination between the German, the British, and the American. Most of the debate is around the question, are we allowed at all, are we allowed to permit active euthanasia, or are we allowed to permit passive euthanasia? And lately there is a question, is there really a difference between active and passive? Okay? And all of them are very problematic. Now, before I will stop and I will let Jonathan to present his perspective, what I would like us to do in the first session, and then if we need more time in the second session of the evening, is to deal both with Jewish ethics and Jewish medical ethics. And what I have here behind me is two Jewish oaths, a medical oath of Jewish doctors. One is the Maimonides, the Rambam. The other one is Asaf HaRofeh. And Asaf HaRofeh. Both of them were in 300 or 400 years apart, the most famous doctors in the Middle East and in the Arab world. And please do remember that modern math and modern medicine, or as we know it today, started in the Middle East with the Arab culture and the Arab scholars. So we have two Jewish doctors' oath, and of course the Hippocrates oath as well. And this time I think that I printed the modern one, not the ancient one. Okay, so we will struggle with that later on as the subtext or the framework that this whole discussion is about, and at about 8 o'clock we'll take a short break, and then I will mess everything up as I usually do and bring some new components into this matrix. Nod your head if you're still with me. Great. Jonathan, please. The next part.
Well, good evening. I'm Jonathan. I'm a doctor, and I lead the hospital palliative care service at Wellington Hospital. So, for those of you who may not be quite clear what palliative care is, it's looking after people who have advancing, incurable illness that will lead to their death at some point. Maybe that's days away, weeks away, months away, and sometimes years away. So it's about how we can provide the best support and comfort as these people confront the fact that their life is shorter than perhaps they would wish. Can you hear? If you can't hear what I'm saying, say,
I can
speak up.
If I could just ask, is there a difference between the palliative section and the hospice? Or are we talking about the same thing with a different approach?
So I do a very similar job that the hospice does at home or in their inpatient unit where they have beds. But we see a slightly different group of patients in the hospital, often earlier on in illness, and often right at the beginning when they first learn what's wrong. And I guess the reason Rabbi Adi asked me to come is that we, in our day-to-day based sort of work, deal a lot with people wishing for euthanasia or raising that as a concern for them, and sometimes they raise it the opposite: you're not going to euthanize. And it's also been a particular area of interest in mine in terms of the medical ethics around euthanasia, and so it's something that I teach the medical students about. And we often have robust and interesting debates about where that, what their thoughts are. And actually, I thought just before I start, I just want to get a sense of where people's views lie here. So, if I define euthanasia as the intentional killing on request of someone who wishes their life to end sooner than it would normally, who here is in favour of that? Who here is against it? And who here is ambivalent? Equivocal?
I'm a bit of it.
So depending on the situation. So there lies the rub, doesn't it? You know, how can you get, depending on the situation, can you get a one-size-fits-all when you're talking about euthanasia?
Not only depends on the situation, but I'm in favor of it in this life, but there's a side of me that doesn't really know what's actual life, and is it okay with God for us to do that? But in this life,
And I guess if we were to go round everyone would have a very clear view in their mind about why they're for it or against it, or what the concerns are which make them ambivalent. And if you look at New Zealand society, whenever New Zealanders, whoever we are asked, what are your thoughts on euthanasia, about 70% of us say we support euthanasia. So the majority of New Zealanders would seem to say that euthanasia should exist. And And there are several countries in the world where it does exist at the moment. So in Belgium and in Holland, euthanasia exists in some cantons in Switzerland, and in some states in America you can get physician-assisted suicide, which is where the doctor doesn't actually do the deed, but actually writes up a prescription so that you can take medication to kill yourself.
You have two different euthanasia, passive and active. Is that correct?
Well, I
Passive
think...
one authorized in France, not the active.
So I imagine that this will be a part of what we concentrate on.
So what statistic of how often it is doubled in those countries that
I
have
can tell you an anecdote. 2 years ago, I was in Swiss, in the Canton de Vaud, and I visited, just out of curiosity, because I lectured about this topic in various places. I visited a euthanasia hotel. That a euthanasia hotel, you rent a room
I mean, what, like,
with
really?
a bed and burial services and a doctor's service, and you dress up in a nice fluffy PJ, you go to bed, you get a little injection, and the hotel takes care of the body and everything. And people, it became a problem in Canton de Vaud because the city hall doesn't know what to do with all the bodies of the people who are coming to Swiss to have a ski vacation and die. That's just an anecdote that...
Because active euthanasia is not
Yes.
authorized in France, a lot of French people go to
Yep.
Swiss.
Yep. Eat fondue and die.
Do you mean skiing accident and die? Or
No, no, no.
what do you mean?
I'm talking have a fondue and die.
The Last Supper.
But so in all these countries there are safeguards, so you're meant to have an advanced illness which is incurable, which will lead to your death at some point. You have to be of sound mind, you have to have a doctor that says you're of sound mind. There's a stand-down period of a certain amount of time so that if you change your mind, you can change your mind. And then if you want to continue it. You know, and there are variations on the theme, and in the Northern Territory about 9 years ago, they also had a bill that allowed euthanasia, and I think 7 people were euthanized up there before it was overturned by the federal government. And our Prime Minister came out last week and said that he's supportive of euthanasia, and actually euthanasia goes on in our hospitals all the time. And I don't know if you saw what he said. And I think it gets to the point of what is euthanasia. And I think it comes to that point of what is passive, active euthanasia, and how do we define what that means? And whether the term is actually useful, passive euthanasia. So if I could just, I think it's really important that when we have a discussion around euthanasia, we get our terms right so that we all know what we're talking about. And I think you're going to talk about passive euthanasia when it comes later on. So I think it's quite... So what is called passive euthanasia is the withdrawal of therapy, which might then go on and lead to someone's death. So for instance, if someone's on a ventilator and you withdraw, the ventilator is to help assist breathing, and then you stop the ventilator, someone might die as a consequence. Or if someone's on antibiotics for some sort of infection, and you stop the antibiotics, they might die. Or if someone is on fluids and can't take fluids for themselves, and you withdraw the fluids, you stop giving fluids, they may die. So people see that as passive euthanasia. And where they use the term is where someone's dying, and you simply stop a whole lot of treatments that are being given at that time.
You have to stop something as opposed to not starting something.
So that stopping and not starting, there is a real... People argue around whether there's a difference between not stopping or not starting, or starting and stopping.
That was actually our conversation on the phone today.
And ethically, there's a whole branch of ethics that look at, is there a difference between starting and stopping, and I imagine in Jewish ethics as well, that would be the same. And you tell us. So, the practice, though, of passive euthanasia, and in France that sounds like what you were talking about, from where I stand as a practicing clinician, I would suggest is not a useful thing. I don't believe that there is something called passive euthanasia. Euthanasia is the intentional killing of somebody on their request. What we call passive euthanasia does go on all the time, but it's not I don't believe it's the intentional killing of somebody. If someone is on a ventilator and they are clearly dying because the therapies that are being given to them are not working, the ventilator is simply stopping a natural death. And by stopping the ventilator, you are simply allowing the natural process of dying to occur. That is a natural thing. There's no active intent. There's no euthanasia. Your intent, if euthanasia is an intent to kill, your intent when you stop the ventilator is not to kill. Because not infrequently, someone will still live despite stopping the ventilator. You're doing nothing to bring on death. If death is going to occur, it will happen naturally. And similarly, if someone is sick enough that they're on antibiotics, and those antibiotics aren't working, stopping the antibiotics doesn't kill that person. The underlying illness does, because they're not responding to the antibiotics. And the intention, and this is the all-important thing, the intention about stopping antibiotics is not to kill that person. And very often, by stopping the antibiotics, actually they get better. So despite, so if we were euthanizing someone, we would stop the antibiotics and make sure that they died.
Just a Jewish footnote. If you recall the discussion that we had about the conjoined twins a few weeks ago, and what was the reason that the doctor decided to go on with the surgery, and that Rabbi Feinstein allowed this operation to take place, was because the result or the intention was not to kill one of the two babies, but to save another baby's life. And that was the outcome. So it's not the same case, but I think that it's the same ethics. And it comes from the Jewish perspective as well, not from just the medical perspective. You're not intending to kill someone, but this is the outcome.
So if by euthanasia we're talking about the intent to kill somebody, what is called passive euthanasia is allowing a natural death to occur, but you don't know whether that's going to happen or not. And sometimes someone doesn't die, but you're doing nothing to actually bring that death on. The natural all medicine can do sometimes is to prolong a dying period unnaturally. And so I would counter to you that what we call passive euthanasia is simply allowing nature to take its course. And whether someone lives or dies, what's going on is not going to have any effect on that. And if someone lives, you support them in their living. And so many times I've seen someone that I thought might be dying who is on antibiotics, which are causing all sorts of problems for them, and they're not responding, or they're on fluids and they're causing a whole lot of problems. And we stop the antibiotics and the fluids after discussion with them or their family. And a week later they go and say, Jonathan, what the hell were you doing saying we were going to die, I was going to die, or, here I am eating breakfast. So the intent is not to kill someone. I just want to get that clear because there's a lot of, and I think the Prime Minister's confusion is that he thinks that the flicking of a switch in intensive care when someone's on a ventilator is killing somebody. Now, if your intent was to kill someone and actually they were likely to survive, then that is killing someone. That's euthanasia. Well, it's murder actually. But if someone actually is sick enough, then no amount of ventilation is going to help them through, because they're actually, the underlying body is broken enough that it can't support life, no matter what. Then that is a natural process. And by continuing to give therapy, I would suggest, is actually prolonging a suffering and prolonging indignity in many people. And for some people there, they say, but whatever you do, you must continue. And in those cases, usually that happens. So I just want to stop there and just make it clear what I'm talking about when we talk about euthanasia. I'm talking about the active intention of killing somebody on request, not the passive euthanasia, which I think is is not euthanasia.
You said that their request, them as the patient or them as the patient's family or decision makers?
So here's the thing, no country has euthanasia on request of a family member. So euthanasia, where it's legal, has to be your own request. And to do it on behalf, to kill someone actively through an intention at the request of family member brings in a huge, another ethical dilemma issue about what's the intention of the family member. So you would like to think that we all come at this from a loving family, but more and more money is an issue, and if someone's going to go to a rest home and get hospital level care, you may get family members that say, don't treat with antibiotics because she wouldn't want this. And actually what they're saying is, don't treat with antibiotics because we don't want her to spend her money on, private residential hospital level care. So it becomes even more murky. So I think for the purpose of this debate, we could go wherever you want, but I suggest that we just talk about you as the patient requesting from a doctor, could you kill me?
I just want to give a reference. There's a beautiful article that you can download. You can find it in Google and download it as a PDF file by Rabbi Shimon Mordechai Glick. He's a doctor and a rabbi, and he deals with Jewish medical ethics. And if you will notice, it talks about the patient, the physician, or the rabbi. It doesn't. Yeah, but he doesn't talk about the family or society. The family, I think that Jonathan gave a good answer why we shouldn't take it into consideration, but I think that what we do need to consider in this equation is society. Whose life is it to begin with? And whose call is it? The doctor's, the patient, whose call? So I'm leaving the question open. I'm just referring to the article, and it's a really good one.
So I was going to just trace where euthanasia has come to from in the next 10 minutes, but I just wondered if there are any questions before I start on that.
Jonathan, does the physician pumping an extra dose of morphine to help someone further along the way, is that passive too?
So again, the issue is, does morphine kill somebody? And I think, so let me ask, does morphine kill people? If someone's on morphine for pain control, does it kill them?
It depends on the dose, doesn't it?
So it depends on the dose. Like any drug that you're on, except perhaps homeopathy, unless a homeopathy jar falls on you, you know, can kill you. You know, any drug is a poison. Morphine doesn't bring forward someone's death when you give it properly, according to what people's pain needs. In fact, the evidence is it probably prolongs people's life, because if you're less suffering and less in pain, you may be able to actually, for some reason, live for longer. And there are several studies that show people who have good doses of pain relief, when you look at exactly the same disease as opposed to those that don't have their pain controlled, those that have their pain controlled on morphine or drugs like that might live for longer. So there's a common misconception that morphine kills people.
I thought it depressed the airways.
So if I gave you morphine now, not that I would ever do that, Sally.
Oh,
but
you'd love to.
I knew the drugs are good. I knew it.
Were I to give that to you, right now, just a normal dose, a starting dose, it would have no effect. You might feel a little sleepy. But if I was to give you 10 times or maybe even 50 times the normal starting dose, you'd be in trouble. And that's the same of many drugs that I could think of. So at high doses, when you're just starting off on morphine, then yes, it will stop your breathing. But if you've got bad pain and you need high doses of morphine, then it won't.
But where does the status of assisted suicide, physician-assisted suicide, sit on the euthanasia thing? Like, I'm guessing there's a scale there.
Well, assisted suicide depends how you want to look at it, I guess. Assisted suicide could be a form of...
Because it is still killing on request.
It's killing
the same
on...
definition.
So there's some people that think this is still euthanasia, and there's other people that like to think it's a separate entity. I think, you know, you've got to make up your mind. But whatever it is, it's allowing a population to have access to death in a way that normally we don't. So it's legal to commit suicide in New Zealand. It's not illegal. It's illegal to assist someone. And I guess the assisted suicide is allowing someone to commit suicide but helping them to do that.
Can I ask a question just around where the euthanasia debate ends? If somebody is legally dead,
yes.
Is there any concern about euthanasia at that point? If there's, you know, their will is said, if I'm legally dead, you can switch off the machines, or is that no longer part of that framework?
If their will, you mean...
Let's say that somebody wrote in the will, if I'm legally dead, pronounced legally dead, the machines can be switched off, or whatever. Because, you know, I'm sure there's been cases of someone who's been legally dead, the machine's been left on, and then suddenly they've come back to life. Where does that fit into this whole debate?
Not really. I mean, if someone's dead, they're dead.
Yeah.
So there's cases where people have been in multiple persistent vegetative states where people think they're not going to respond, and you look at their brain and scans, and the brain has got significant damage, and the wisdom would be no one's going to be able to be conscious in that. And every so often, you know, people have been looked after for 15, 20 years. Suddenly, you'll get a case, you know, where they begin to show signs of consciousness. So that has been described. I'd have to say it's rare as hen's teeth. I mean, it's really, really rare. But it's those one-off cases that drive people the other way and say you should never, you know, everyone should be on a ventilator. Anyone that has a stroke or who has dementia should be fed for, you know, when they can't feed themselves and when they can't breathe for themselves, they should be put on a ventilator. So you get people arguing the opposite to euthanasia, which is, as it were, that we must do everything possible to maintain life, even including giving artificial feeding, ventilation, and the like. So you get two different pressures, both at the extreme end of a spectrum.
I have two questions. First, it may be for you to exclude it, because you're saying that we will talk about when the person concerned wants euthanasia.
Yeah.
The whole problem in so many cases, you're certainly aware of that, happened in France, in the UK, probably somewhere else, that actually the person is, let's say, 90% disabled, not able to communicate, and the whole problem is to make sure this wish expressed is not because of pressure of the family. So you said it doesn't come from the family, but it comes from seeing the mother always taking care of this person, and the person feels like a burden. Therefore, it's not that he can't handle this life anymore. It's just that he doesn't want to be a burden for his family anymore, and that is not a reason for euthanasia. This is very, very slightly different. It's not that. You see what I mean?
I do, and when you ask people why they are for euthanasia, there's a top 10, 3 reasons. And one of the reasons is, I don't want to be a burden on others.
But this
So
is
that's a very
assistance to
So that's a very common reason why people might wish for euthanasia to be legalized, because they look to the future and they say, I don't want to be in a place where my family has to care for me, look after me. I don't want to be a burden on them. I would feel guilty, and therefore I would like the safeguard of having the option of knowing that I could say enough's enough.
In this case, it is, well, legally, it is assistance to suicide. It is not euthanasia. Because if you stop the machine,
Yes.
the person won't die necessarily. So it's just, it will continue to be a burden for the family. So it's in this case, it's more a wish of active euthanasia, of injection.
It is,
of
yes.
medicine dose. And this is different. But yeah, the second question I had was about, and you mentioned it, so maybe you will talk about it later on. It's about medical harassment. Yeah, medical harassment. When do you stop the treatment? When do you know that enough is enough and you're just
Usually not those that keep on trying
Yeah.
and trying.
and they know that they can keep on continuing, but is it really better will it make the life of this person better, or is it just another cable that you would stick in his throat?
So when is good enough good enough? The tension is, one of the fears of medicine now is that it's become so technical, and it can achieve so much that perhaps sometimes, if practiced incorrectly or without humanity, it can sustain people in a manner to which they wouldn't wish to be, and people worry that they won't play a part in that conversation about what they would wish for or not. So in New Zealand, there's a code of the Health and Disability Commissioner's Code of Rights, and everyone has a right to refuse any treatment. So a doctor, might recommend something, but at the end of the day, this is your life. If you want it, you can have it. If you don't want it, you can say no. So in the old days, and probably a little bit still now, there is a paternalism that goes on in medicine where people feel that they cannot say what they would wish for. Because, well, if the doctor's saying it, that must be right. But there's an increasing shift of people saying, I hear what you're saying, but this is my perspective. And actually, the best conversation is, let's talk about this together, and work out what's best for you. You know. Yeah.
I listened carefully to what you say, and it seems like you're describing a new oath for doctors, that is humanitarian oath. And my question is, if it doesn't contradict the other oath to save life, or to treat a person whenever they need help. Because I can see a clash there.
So here's the thing, I mean, is medicine's role purely to save life? So where possible you should save life, and if you can't save that life, you should make life as comfortable as possible. And the thing that's always left out is, in where death is coming, one of the roles of all people in clinical fields should be to allow someone to die comfortably, to care for them compassionately and ethically. So medicine has a role right from preventing death and saving life to allowing people to die naturally and supporting them to do that. So it's a spectrum, and where it's quite clear that you can't save someone's life, then you should acknowledge that and say, so what can we do to ease death? And by easing death, I'm not meaning cause death, I'm meaning make people comfortable. And where we've run into problems in the past is that ability to recognise when treatments aren't working and to continue treating sometimes gets blurred. And so doctors find it difficult, or clinicians find it difficult sometimes, to disengage themselves from the acute things that are going on all around, to see the bigger picture. And I think the role of autonomy in ethics, you know, the right of the individual, has come out of the fear that somehow medicine may take over and take control of their body. So, does that answer that question?
Yep, but if you don't mind, before we'll take more questions, I'd like to throw another Jewish component to this discussion, and I really appreciate your answer. And Rabbi Yosef Radbaz, Rabbi David ben Zimra, at the 14th century, dealt with a question that is very similar in Judaism, who say that whoever saves a person's life in this world is saving the whole world. And there's another mitzvah saying, Lo ta'amod al dam re'echa. If you see someone that needs help and you can prevent this person of dying, you cannot stand aside and look to the other way. If you cannot do it yourself, you need to bring someone who can. If you cannot do that, then you need to call someone. You need to do something active in order to save someone's life. And then on the 14th century, the Radbaz, Rabbi David ben Zimra, had a very unique question, she'elot v'tshuvot, question that came to him. What happened if a person is dying and you can't help the person, but there are things that prevents the soul to leave the body? And there is a whole halachic discussion, and I think that it relates to what you've just described, as when you need to give up, not to give up, but to respect the fact that you cannot help anymore. And it was the first time that a rabbi that was well known in his era wrote that you need to do whatever you can to help the body live, to help the soul leave the body. However, you cannot intervene in this person's medical condition. And what he's describing is that you need to stop. If someone is working in the backyard with a hammer and it causes the person who's dying agony, you need to do whatever you can to stop the person from hammering. If there's a bad smell in the house, you need to aerate the house, ventilate the house, to make him feel more comfortable. You need to do whatever you can to help this person to go in peace. And I think that it's the first time in the halachic thought that they actually acknowledge, the rabbis acknowledge the fact that there is a certain point that you cannot help anymore. And you need to do whatever you can to help the person to go in peace.
So could I comment on that? So if I was to say, who here wants to die? What would you say? I mean, not now. Or who here is going to die? Let me say.
One of us, one day.
So is dying an optional extra? Is dying, and yet, by saying that the role of medicine is to save a life, the logic is that every life is able to be saved. But it becomes quite clear when we acknowledge that life is finite, that for every single one of us at some point our life is unable to be saved. We will die at some point. And so the thing that you're talking about, I think, is one of the fundamental principles of what medicine should be doing, which is to save life where life can be saved, and where someone is dying, to recognize that that's happening and allow them to die. And that is a major shift in terms of thinking, I think, because from the middle of last century to now, medicine has been concentrating on saving life. And I just want to take you back a little bit. Would that be okay? If you go back to the 16th, 17th, 18th century, the Judeo-Christian Western way of death and dying, especially in Europe, was death came early, death was very quick, so the average time from getting sick to dying in Elizabethan times was something like 2 to 3 days, and you die in your 30s or your 40s. And right from the beginning, if you, the church would prepare you for dying.
This is why when you sneeze, they used to say, bless you.
Mm.
You're about to die.
Yeah.
God bless your soul.
And so for people that couldn't read, every church community...
That's the reason.
Bless you, my son.
Thank you.
Every church community would have a set of lino cuts. And these lino, or these cuts, these prints, were teaching people how to prepare for the good death, for dying well. And if you died well, you then went to heaven. And if you didn't die well, maybe you went somewhere else.
A little hotter place.
Yes.
BJ.
And so you could redeem a lot of your past sins by actually dying well. And that was the teaching. So medicine then came. And medicine's role was to diagnose, to find out what was wrong. Maybe to put a suction cup or a leech or some arsenic, some poison, and give it to you and say, go well, but also to help people to die. One of the roles of the doctor was not euthanasia, but was, if someone was dying, to try and ease their dying. So dying was very much a part of what society accepted as our role, what we had. And then you come across medicine changes, and medicine invents things like surgery and anaesthetics. And suddenly, instead of dying from your appendicitis, you could actually cure your appendicitis. Or if your bowel got blocked, instead of dying from that, you could actually operate on it and stop the blockage. And then antibiotics were invented. And instead of dying from your pneumonia, which often was a common cause of death in Dickens's time, you could now cure people. And so medicine came from a position of diagnosing and actually alleviating and helping people if they were dying to actually curing. And the focus then became on saving life more and more. And as medicine's technology advanced, so that became more and more part of what we do, save life. And you just need to follow the press now. Whenever a new drug is released on the market, it's a new wonder drug that will do something, or don't eat chips because they'll cause dementia, so therefore, there's always something more that hints at, if only we do it right and take the right drugs and have the right lifestyle, we'll live even longer. And the corollary of that is we'll live forever at some point in our life. And we've lost the dialogue about how we then approach death and dying in our post-modern society. How do we incorporate the fact that we are all finite beings and will at some point die? And that's where this fight back with autonomy has come from. And patients' rights and human rights. I have a right over my body, and I want you to treat me so that you can keep me alive as long as possible, but I also want the right to be able to die when I feel that right is, and that's where euthanasia comes from. It's taking back, one of the things is taking back that control. And when euthanasia, the word was first described by a chap called Munch in 1920 or something, I can't remember. It wasn't about killing someone. It was about it was about easing death, the dying process. It was about making sure that people were comfortable. And in the, I think it was in the Lancet, the medical journal, the Lancet, that first described euthanasia. It was saying you should give morphine or drugs like that if people are in pain to ease the process, not to kill them, but that is medicine's duty. But then antibiotics and surgery came along and it got lost. Euthanasia was redefined as the active killing on request. And that's, so I just thought it would be just useful just to put the context of the debate that we're having.
That's the one or two questions.
I have a non-medical question, bearing in mind the Judaic concept that we're supposed to be discussing. This morning I read that at the turn of last century, the average lifespan was 47 years. Today it's over 80. A survey was conducted by whatever the university was, and they asked a group of people, about 3,500 people, if you had the ability to live to 90, 120, or 150 years, what would you want to do? And that struck me. And I said, I don't know if people really understand the society in which they live, which will not permit them to live comfortably. I'm not saying that they wouldn't be able to live, but live comfortably within the society when they're 90 or 120 years old. Because society is not prepared to deal with someone that age. And I can cite as a particular example myself. I'm of a certain age. I'm halfway between 70 and 80. And I find there's less and less use for me as an individual. And as I progress and getting older, there'll be even less opportunity for me to be able to somehow contribute. I mean, I have my own reasons for being here and what I'm doing. But aside from that, it's a personal thing, and it's only circumstantial that I happen to be here. But I can't find work, and I certainly feel I'm still capable of being a productive individual. So where does society support an individual as they age, even though they may be in relatively good health, and their demands are not great, they just want to live. But then you become intellectually morose.
Once again, I'll give references to this article. And I think that the question that you're putting in front of us is not about euthanasia, it's about the value of life. And who actually define the value of the individual life? Is it the individual, society, the doctor, and the physician? I think that, as he just described, in the last 100 years, the average lifespan has doubled itself. And today we have places that didn't exist in the society 100 years ago. If we're talking about retirement villages, there was never a concept like that 100 years ago. And I think that if life expand will be longer, we will find the society, the younger society will not do it for. I think that people will take responsibility and do it for themselves. But one of the problems with modern society, and usually when I teach modern ethics, and I'm talking about war ethics, one of the problems that we see in the modern world is that there's a tremendous technological progress and hardly any ethical progress. We're still talking about mid-ages, Christian, Jewish, Muslim, or Far East based ethics. We weren't able to develop or to make this ethical gap to the technology that we're dealing with today. It's beginning if we're talking about ecology, if we're talking about nuclear power or other things, but as humanity, we're not there yet. So I understand your point. I think that it's not really about euthanasia, it's about the value of life.
But I believe that until society has prepared, believe me, these retirement villages are nothing but saving banks for the inevitable. Basically, if you were to speak to the inhabitants who live there, after a while they adapt a certain kind of social approach to their day-to-day existence, and it becomes less and less demanding, and in a way it is euthanasia because they themselves are almost willing themselves to expire.
So if I rephrase it, you're talking about social euthanasia?
You want to call it social euthanasia? It's okay with me.
I'm not sure I see the same that you see in that portion of the population. So the people that I talk to that are like that are in those homes, depends what level of home and how disabled they are, but those that actively are able to care for themselves and have their own unit, I'm not sure I see those views so strongly expressed like that. But I think there is a point about when we celebrate that we live for longer in New Zealand. Every year the statistics come out that say New Zealanders live for longer. And everyone says, yippee! You know, that's a good thing. We're living for longer. Surely that must be good. But what we don't say is that we're also living for longer with more illness. So in the old days, you know, 100 years ago, where you were healthy and then you died very quickly, and now we get much older and we live for longer, but we also live for years with chronic illness. So there is a, you know, for every silver lining, there's also a bit of a lining of coal. And I think what you're describing is, you know, that so we are living for longer, but society isn't keeping pace. So we have what, like, you're describing like holding bays for elderly people until they die. But we, you know, what is our approach to aging in New Zealand? How do we respect, care for our elderly who are unable to look after themselves? And the thing about euthanasia is, again, you hear some economists saying it would be cheaper, you know, if we had that. And so for those people that are pro-euthanasia, or I think a very strong argument in the culture that we're entering into is, so at the moment we're seeing it as an autonomy thing, but what if it becomes a financial driver of care? What if the government brings it in not because it sees this as what is an individual right, but because it can't afford our care?
But that's quite a realistic scenario. That's
Well, I'm just saying,
over.
and so I'm just putting it out there. What if euthanasia is not driven anymore by individual rights, but is driven by financial imperatives? So there's almost a pressure on you to die because you're costing New Zealand too much.
There was a movie called Soylent Green many years ago. It touched on that very subject, on the costs of day-to-day living, and when you live a certain, when you arrive at a certain age, you're reprocessed.
This is what the
You have
Inuits are
value
doing,
as a
or did the Eskimos. When you turn 60 or 65, you walked into the blizzarding storm because you're a burden on society. It's not a movie. It was part of their culture.
But in Soylent Green they ate them.
Pardon?
In Soylent Green they ate them after. So they
Yeah,
were
no, they made them food
crackers.
capsules.
So it gets more and more exciting. But I think, so for me, I think the root of euthanasia, not the root of euthanasia, but as we look after ourselves and work out how we deal with an aging population and ourselves who are aging, and autonomy versus community versus, you know, the thing about euthanasia seems to polarize rather than bring together.
Actually, my question has changed since I put my hand up before and now. But so do you see it more of a question, a sociological and psychological question of teaching society about death, so they feel more comfortable with dying and aren't willing to push the button that fast?
I think if we had a society that was at ease about talking about the role of death and dying, and about how someone might wish to die, we would not have so much pressure for euthanasia, would be my sense. If we could make sure... So let me ask you, advanced directives are the ability to write down and tell someone, if you got sick, what you would wish to have. The sort of care. If I had a stroke and could not feed myself and was unable to communicate, I would not want antibiotics or artificial feeding, stuff like that. They're legal in New Zealand. You are allowed to do that. How many people here have an advance directive?
I have an oral one. Does that count?
Well, it does actually. In New Zealand, an oral one does count.
But it depends who it's with, right?
No. Unfortunately, we don't have any statute that describes exactly what an advance directive should look like. So an oral one is less likely to be followed than a written one, but as it stands at the moment, legally, it still should be honoured. But people will find it more difficult to follow that than they would something that's written down.
Isn't there a danger that you issue an oral directive and then over time, as you get closer to death and suffer all sorts of illnesses, you change your mind? But how do you know that your second directive is the one that's going to be taken up?
So that's where being comfortable with the conversation about death and dying is really important, and that you have it with your families, and see advanced directives are things that are not set in stone once they're put in place. They're a moving feast, and what I think now, at the age of 45, may be very different to what Sally thinks now at the age of 60, whatever. No, But you know, my views will change, and we know that most people's views actually do change. So when we're younger and not challenged by illness, or if we have a family member that has a serious illness, we may come to one conclusion, and when we have an illness ourselves, our views change. And so this whole thing about advanced directives and discussions is that unless it's open and unless we have a process by which we can do that, the danger is that, well, I said that 20 years ago, but that's not the case anymore, so it does need to be re-examined on a regular basis.
Jonathan, I have a bomb to drop, and a question that I deal with from different perspectives is when people make a decision and they come to me to reaffirm their decision theologically. And I think that when we're talking about active euthanasia, people already made a decision. Why do you think that they come to the doctor? They have the option of taking their own life. Why do they come to the medical institution, to the doctors, to the hospital?
Well, I think they don't often. Actually, I think very often they don't tell doctors what's on their mind if they think that the doctor isn't going to support their view. So there is a degree of doctor shopping amongst people that are very pro-euthanasia until they get a doctor that's sympathetic. Now, but the bigger picture is, if you can take your own life, if you can commit suicide, why is it even an issue? I think people are wanting to know that if they get to a point where they can't take their life, that society will allow them a way out. So it's more if I have a severe stroke and I can't do anything, or if I get to such a place that I'm so weak that I'm in bed and life has no meaning for me anymore, I want to know that there will be a way out of life. So I think that's why, even when suicide is legal, and I think other people also know that many people who try and attempt suicide don't succeed. And so it's kind of, I want to make sure that when that time comes, this will succeed. So I think it's a rich mixture of different things.
When my father was ill with emphysema, he considered committing suicide, but his reason for not doing so was that he was worried he would get it wrong, make himself feel absolutely worse, and end up a helpless vegetable. And that was his fear. You know, if he knew that he could have just taken something and done it, he would have gone. And given that the last of his life was pretty miserable and a pretty poor quality of life, I would have supported him in that choice. But that was the fear that of getting it wrong, as you said, you don't succeed.
When did it become society's problem, I guess? Because like you say that you want people, they want to know that society will allow that to happen. That if they get to a vegetative state where they can't make that decision for themselves, then that could all happen. But is it just the ethical problem of is the assisting physician a murderer that makes it society's issue, or is it just kind of butting it? Because at the end of the day, it shouldn't be my call ethically if somebody in hospital should be allowed to finish that or not.
So whose responsibility is it? So why should it be a doctor's? Why couldn't you go to university and study to be a euthanologist, and society train people up to euthanize people? Why would it be a doctor's role? Because surely a doctor's role is to save life and to comfort those that are dying. But to take life, that, many people would argue, fundamentally changes the way society interacts with people that are there in a position to hopefully save their life or ease their pains. And if they know that the doctor can actually kill them as well, what does that mean in terms of the relationship that people have when you go to a doctor?
John, can we give permission for, well, there's a contract with doctors and a patient for abortion. We have that paradox.
We do. I agree. So society has, depending on how you view abortion, sanctioned death. Whether you see abortion as killing life, or this is a non-viable life at that point and therefore it's a potential life. So people have their own ethical, religious perspectives on how they view that, but you could argue very much, well, if you allow abortion in society, isn't it hypocritical not to allow euthanasia? So,
1, 2, 3. Okay.
Another reason for having assisted suicide, if you will, is because quite often the person who wants to expire will consider the family's situation as well. And quite often, no matter how that individual feels about suicide, it reflects on the family. And therefore, they're looking for a vehicle to put the blame on, if you will, in a sense.
Not to be buried behind the fence.
Sorry?
Not to be buried behind the fence. Over the fence.
To be
Period
That-
behind the feet.
So that's, to my mind, another consideration. If someone is feeling that concerned about familial situations. On the other hand, it seems to me if you have a vial of helium in your room, you know the difference. You open the door and it's gone.
I'm not sure I quite follow you on that one. The helium.
Not a vial, but a bottle of helium.
Yeah.
And you let the gas escape.
He will speak
Sorry. Yeah. Question to you.
Sorry. Please.
What does the good book says? I thought it says that commit suicide is a sin. Is it true or not?
It doesn't say it in the Bible. That's a rabbinical position. However, the Jewish position is that life doesn't belong to us. Life belongs to God. And this is why, wait up. This is why we say, Adonai Natan, Adonai Lakach, Yeishim Adonai Mevurach. Okay? God gave us life, God took life away, may God's name be blessed. Okay?
We have another sort of question there, which I thought about an hour ago. But partly you sort of touched that question, that we have a body and soul. So, what if you will look from the point that God gave us soul, right?
And you still have it after it leaves the body.
That's right.
What is the question?
So about still about the sin to commit suicide.
Whether it's considered a sin.
In Judaism, committing suicide is considered a sin. This is why people who commit suicide are being buried behind the fence. Okay, and it's considered as a sin that you cannot repent from.
That's right.
This is why it's considered as one of the worst sins, because you can always repent in Judaism, even if in your last breath.
So is euthanasia sinful?
Euthanasia?
Yeah.
If it's about taking someone's life, the answer is yes. If it's about taking obstacles that prevents the soul to leave the body, the answer is no.
And that's what I think we get
from the
confused.
Jewish
No.
perspective.
So I don't think that's euthanasia, you see. So
I agree with you.
allowing,
Passive
it's not the
This
issue.
is why I didn't use the word.
Yeah, but that's what.
Preventing the body to leave, the soul to leave the body. If you remove the obstacles, the answer is no. If you are intentionally helping a person to die, yes, it is. It's taking life.
Yeah.
And this sin is considered from both sides, suicide and killing.
Suicide is taking your own life. Killing is taking someone else's life.
I get that, but
Both of them.
If I have asked you to euthanize me, that's my way of killing myself, right? Am I a sinner?
No,
too then?
you're not killing yourself. I am. I am killing you.
So then the sin is on you, not on me. Is that
Yeah.
what you're saying?
Yes.
Yeah, but that's
But
not
if
fair.
you're asking me, do not resuscitate me in case something will happen to me, or let me go in peace, then it's a different issue. Then I don't prevent your soul leaving your body.
So that's really
And that's the
interesting.
difference between, I think, what Jonathan said before about euthanasia, which is actively killing a person according to their own request and not intervening with the natural process of dying.
I totally get that, but I have never stopped before to think about the religious side of things in terms of sin. That by asking someone else to kill me, I'm freeing myself from the sin.
But it's actually a bigger sin to make someone else
Okay.
do it for you. This is why a Jew cannot ask another Jew to light the lights on Shabbat. Okay? If it's a sin for you, it will be even a bigger sin to make someone else make this sin
So you can
for
be
you.
a shaliach avera.
Shaliach לדבר עבירה. Yeah. Which is actually worse. There's only one midrash that we find in the Babylonian Talmud, and I mentioned it twice before about Reish Lakish and Rabbi Yochanan. Reish Lakish was his best disciple, best student, that made him think and rethink his halachot. And they had a huge fight over a halakha. And then Rabbi Yochanan announced that for him, Reish Lakish is dead and no longer one of his disciples. And it was a big problem because he was also married to Rabbi Yochanan's sister. And his mental condition and his health was deteriorating fast. He was about to die, and the sister came to her brother asking for him to apologize and to take him back as a disciple, and he refused, and in the end, Reish Lakish died. And then Rabbi Yochanan lost his mind, and they tried to give him another student, another apprentice, and it didn't work. And that's the only place in the Jewish tradition that we find a very small section, one sentence saying, התפללו עליו תלמידיו, התפללו רבנן ונח נפשי. They prayed for him and he rested in peace. His soul got a final rest. Now, is it an active killing by praying? Is it a passive killing? We don't know. But that's the only time that we find that this type of thing was done in Judaism. And it's very controversial. Now, is it a sin to pray for someone's death? According to most of the rabbis, the answer is yes.
I know that some people may remember that as well, that quite a lot of people who are not happy with the decisions made by the Israeli government.
You're talking about the Pulsa di Noura.
Yes, and Ariel Sharon is still in coma. A few months after, or a few weeks after only. And they did the same for Shimon Rabin, and he died.
I think that I'm not a person who believes in Jewish mysticism. Okay, I'm far more rational for that. Yeah, sorry, that's my Jewish belief.
Jewish
and
what, sorry?
Pardon?
The first word you said, Jewish.
I don't believe in Jewish mysticism when it comes to curses and blessings and stuff like that. I do believe in the power of blessings between people, but not to combine magical forces or something like that. And I think that the problem with Pulsa di Noura is not that you're praying for someone to die, is by the social legitimation of 100 rabbis assembling together saying that this person needs to die. And one crazy person like Yigal Amir will pull the trigger. Okay? It wasn't from heaven. It was from one of the people who heard them and read between the lines what they were trying to say and were too afraid to do themselves.
In this case, are they?
It's not euthanasia.
Yeah,
it's
no,
murder one. I don't believe that any divine forces killed Rabin or put Sharon in the hospital.
I've just got a text from my wife saying it's our anniversary tonight. And she's saying, I'm outside. Time to wind up.
Thank you so much. Is there a message you want to leave us with before you go tonight?
Well, I think when it comes to euthanasia and the right of the individual to have a say in when they die, you do have a say now with advance directives and having proper discussions with your family and your doctor so that people know what it is you might wish for, you know, how much intervention you might wish for if the time came. When it comes to euthanasia, though, a law to allow us to die and be killed when we would wish, whilst I understand in principle, this is my own view, in principle, why you would have that. And I see people ever so often who are absolutely fixed in their view about that. I wonder at our society whether we have the ability to oversee it and police it and stop it becoming something other than about the individual. And if I now can, as an individual, say this is what I would wish, what about for the person that can't talk? And what about for if I don't have a, so if you do it for when I have an incurable illness, what about the time where I just have a chronic illness like depression? And I just think, you know, I might have decades to live, but I think I want to kill myself now. Or what if you don't even have to have a reason? What if a teenager says, I've had enough, you know? So I think there are all sorts of ramifications about what euthanasia might do in the society. And if we had time, we could look at what's going on in Holland and Belgium, and you know, and because there are concerns. So in Belgium, in Holland, children are getting euthanized, you know, at sort of who within their first year of life, without any conversation with family or anything, because the doctors are saying this person wouldn't have a chance of prolonged life. It would be better to end it now. And I just wonder whether as a human society, not as an individual, but as a society, what allowing euthanasia might do. So while I support an individual's right, I do get concerned about society's response to that. That would be my sense.
Thank you, Jonathan.
Thank you very much. much. You know,
And
not
we will
stay for.
artificially maintain your life by letting you go.
Yes, no, that was. I am on life support as we speak. Right. Thank you. Bye-bye.
Let's take a break. I think that we all need to process some of the things that we've talked about, get some caffeine in our bloodstream.